Vaccine guidance from the CDC. First Alert 6's Brenna Kiefner is live in the newsroom to explain what this means for you and your family. Brenna?
Brian, the CDC is changing how Americans approach the COVID-19 vaccine, emphasizing consultation with healthcare providers rather than just a blanket recommendation. They also have new advice on the chickenpox vaccine for toddlers. For COVID-19, vaccination is now considered an individual decision based on personal risk factors and health history. This approach, called shared clinical decision-making, means patients should consult with their healthcare provider, whether that's a nurse, doctor, or pharmacist, to weigh their own risks and benefits before deciding to get the shot.
As a healthcare provider, we would just review with them some of the risks and the benefits of the COVID vaccine. That's what we're responsible to do based on the CDC recommendations.
For adults under 65, the CDC says the benefit is highest for those with risk factors for severe illness, like certain health conditions, and lower for those without.
I think it's an excellent change. It just now makes it less barriers, so it's more protection for everyone.
The CDC also recommends a standalone chickenpox vaccine for toddlers, separating it from the previous MMRV combination shot.
The reason they did that is they suggested that it lowers the risk of fever-related seizures, but while still maintaining very strong protection.
But experts say this could help Douglas County with a bigger challenge. According to a recent survey by the Douglas County Health Department, only 13% of parents said that they were willing to vaccinate their children, the lowest rate that they've seen in years.
Hopefully some parents that might have had some hesitation because they thought that was too much, too many vaccines at once, they might be more willing to have their children vaccinated.
Nationwide, the CDC says the updates are designed to simplify vaccine schedules and strengthen trust. Local experts hope this collaboration between patients and doctors can ease concerns about vaccinations.
There, unfortunately, is a lot of misinformation out there about vaccines, but we know that vaccines are among the most studied medical products in history.
But I think it's important to try and think of others. You know, if you don't know if you're ever going to be around somebody who's really, really sick, really immunocompromised.
Now, both the COVID and the chickenpox vaccine updates are readily available, and healthcare teams across the state are ready to help families navigate what is next. In the newsroom, Brenna Kiefner, First Alert 6.
Good information to know, Brenna. Thank you. Peace talks.